Hey guys, this is Ryan from Pathophysiology. I'm doing my presentation on rheumatoid arthritis. I apologize for the janky setup, but this is what we got. So, I have this visual right here, and I've written a bit of a poem to go with it. So, I call this poem, Oh Rheumatoid. Rheumatoid, oh rheumatoid, this arthritis I have. Started so minimal and got really bad. First aches in my feet, my fingers and hands, not debilitating at first, though a weird warmth my joints had. Knees, shoulders, and hips followed soon. My progression was fast, which may not happen for you. Eventually my lungs and heart followed too. A trip to the ER, and then I was through. But I'm getting quite ahead in my story just now. Let's break it all down and talk about how. The cause no one knows, genetics some say. Also environmental factors and smoking can play a serious role in the worsening of my health, though the reason for the disease doctors don't know themselves. My T cells decided on this here day that a membrane was within wasn't us, no way. So it attacked and it fought, inflamed all along, and the synovial lining in my joints got all wrong. Stage 1 is the start. Stage 1 is the start. Synovitis, the symptom, the inflammation of the synovial membrane and the fluid within them. X-rays don't show much, just some swelling of soft tissue, though the pain I am feeling is becoming an issue. Stage 2, it has spread, the synovial tissue, inflamed and enlarged, narrow joints I've now got to. Backside. Stage 3 begins the pannus, my least favorite friend. The synovium tissue has gone quite off the bend. Forming a growth in my joint, something entirely new, the pannus in there digests my bones too. Along with the cartilage, which has shrunk quite a bit, moving around these days causes me a serious fit. As the shapes of my joints are all out of whack, the pannus has left them with the cartilage lack. Stage 4 is the worst, but just really the end. Inflammation has subsided, though my joints will not bend. Fibrous tissue has formed, and bones sometimes have fused, creating a joint that I really have no way to use. Along with these stages come complications aplenty. Interstitial lung disease is most prevalent among many, although cardiovascular disease and infections come too, though the exact way these connect is a mystery, true. While we search for a cure, we focus on protection mainly. Early detection is the key, that much we know plainly. Mitigation of symptoms prevents permanent damage, and early drug intervention helps all of us manage. Some of the best drugs are DMARDs, biological and not. DMARD stands for disease-modifying anti-rheumatic drugs. Rhyming with that, I will not. Slowing the progression of the disease is the best they can do, which long-term saves cartilage and mobility too. NSAIDs and steroids have a role to play. Local injections of prednisone helps a bit, they say. Nutrition has been studied and tested here too. Unfortunately, clinical trials have not shown much use. Being nutritionists and all, we know it will matter, but the science as such has yet to show a pattern. Though a few gems from food have found their way through, fish oil especially shows strong clinical use. Additional sources say low inflammation foods are best, though digging for studies make that seem like a guess. Surely these processes are deeply connected, but as the disease exists now, a dietary solution has not presented. So, that was my bit of a poem there. I'm going to give you the close-up, better view of what my illustrations are here. I have a healthy joint going on right here. These are where two bones are meeting. We have the cartilage in blue here, the joint capsule which holds it all together, the synovial membrane, and also the synovial fluid within, which kind of keeps the whole thing lubricated. As we move along here to the stage 1 of the disease, You have the synovial membrane inflaming, and a lot of this is being caused primarily because as an autoimmune disease, the white blood cells in your body are actually attacking the synovial membrane and releasing cytokines, which are then forcing the synovial membrane to release even worse things, which causes damage throughout. These are my little white blood cells there. Stage 2 over here, we have synovial membrane getting further inflamed and continuing to grow, and you actually see some narrowing of the joint as well. Flipping over to stage 3 side, gets a little bit funkier here. This is where real bone damage is actually occurring. Formation of the pannus here, which is actually synovial membrane, kind of becomes a different thing known as the pannus. You have the breaking down of cartilage as well, and that's become pretty severe at this point in stage 3. Stage 4 is actually full-on fusing of the joints. So there's reduced inflammation at this step, but it's basically just because everything's already pretty messed up, and it's just the bones are becoming fused and not even useful anymore at that point. I've listed some of the complications up top here. I talked about interstitial lung disease, cardiovascular disease. There's an increased risk for infectious diseases as well, along with skin nodules, rashes, scarring of the eyes, and even worse stuff kind of throughout your body. Some of the treatments, the DMARDs I talked about, they're disease-modifying anti-rheumatic drugs. They're especially effective when paired with some newer DMARDs that are a biological set of them. They work well together. Steroids, also cortical steroids and prednisone. A lot of those are injected at site, specifically prednisone. NSAIDs for help as well, as does rest and physical activity. The disease actually likes sometimes rest, sometimes physical activity, depending on how people's flare-ups are going. Joint support can be done using splints, so actually giving your joints a rest with splints, along with physical therapy, and really the only main food that they've seen a noticeable clinical success with is fish oil. So that's it for rheumatoid arthritis. I would love to hear feedback. If you have any questions beyond that, hopefully I can answer them. Thanks so much.